Well, thank you so much for joining the webinar today. I'm Dr. Allison Feldt, owner of Body Motion Physical Therapy. And today we are discussing the topic of difficulty with intimacy and how pelvic floor therapy will help restore confidence and pleasure. And so we're going to touch on a lot of different factors around intimacy. What is intimacy? Difficulty with intercourse. There's a lot of psychosocial aspects of this as well. So not just body aspects, and we'll touch on that stuff too. So thank you for being here with me today, and we'll get started. And actually, before I even jump into this, I just want to say that if anything we talk about, or if you have any questions, always feel free to email us. And we also offer, this is free to be interactive, but if you don't want to share on the chat what's happening or anything like that, then feel free to request a discovery visit, and you can have a free discovery visit with one of our doctors anytime. So I'm just going to go ahead and read that. So sex and intimacy can be very important in our ability to have deep relationships with our partners and find fulfillment in our own lives. So we have a lot of people come here that end up having difficulty with just their relationships in general. And a lot of times it's because they don't feel confident participating in intercourse, or maybe intercourse or any sexual interactions are not comfortable for the person experiencing them. And so that can relate to negative experiences within the relationship. That can put strain on your own self. It can put strain on your partner because your partner doesn't want you to be uncomfortable or have issues around the intimacy that's happening. So there's just a lot of things. This is multifactorial and not just the body, not just the mind. And so we're going to talk around some of that stuff. We're going to talk about how orgasms and sex are normal and healthy, but our culture doesn't always support the importance of that for women or for people with vaginas. And really, the price we pay for thinking of that is many women, many people born female, do value sexual pleasure, and we're just not honestly allowed to think that that's okay. And so the fact of not having that can cause dissatisfaction. It can help one feel not as adequate. So these are some important things to think about when sex or intimacy is impacting the relationship. A couple of things that we talk about as what is intimacy. So intimacy is not just sex, but it's cuddling, touching, connecting. These are all forms of intimacy. But intimacy can also include intercourse and orgasm. And we're going to talk around some of that today because it's really important that you understand that people, if there is trouble with penetrative intercourse, or if there is trouble with intercourse or orgasm, that those are often signs of pelvic floor dysfunction. And there's a ton of stuff we can do to help with that. And most of the time, pelvic floor therapy might not be what is recommended. Sometimes it's pharmaceutical, sometimes it's counseling, and counseling can be a huge aspect of what needs to happen. But there's the pelvic floor and the body itself is also very important. And when it comes to pharmacology and finding drugs to help improve orgasm or improve the tolerance of intercourse, there's just no research that's actually supportive that says there's any pharmacological benefits for women to help them experience orgasm or help them improve intercourse. Obviously, there are those aids for men or people born as men or people with penises. But there's not that for women or people born female. So problems with difficulty with intercourse are common. They affect people around the world. Some diagnoses that you might hear when doctors are describing problems with intercourse would be vaginismus, vulvodynia, dyspareunia, and anorgasmia. And anorgasmia is just the inability to have an orgasm. Dyspareunia is painful intercourse. So that could be with initial penetration or with deeper thrusting. Vulvodynia is pain within the vulva itself. So it'd be pain in any of this area. And then vaginismus is spasm of the actual pelvic floor muscles. So those are some of the common diagnoses. There Okay, cool. So what is female orgasm? So female orgasm, I'll just read you this quote here. An orgasm in the human female is variable, transient peak sensation of intense pleasure, creating an altered state of consciousness, usually with an initiation, accompanied involuntary rhythmic contractions of the pelvic floor. So this is the superficial pelvic floor, and they often cause uterine contractions and anal contractions. And so it's induced vasocongestion and myotonia, generally with an induction of well-being and contentment. So that is the definition of orgasm, pretty much saying that an orgasm is when the pelvic floor muscles have contracted enough times to reach climax, and then you get a state of well-being. And so the pelvic floor has to be able to function in order to reach that state of well-being. There are many factors other than just the pelvic floor that that can affect orgasm. And so I'm pausing here to look at the chat. Hopefully, Devin, you'll see somebody if they pop in here, because I wasn't looking at that. So I don't know if anyone had been trying to get in. Okay, back to the presentation. So the psychosocial factors that can affect orgasm are age, education, social class, religion, personality, and relationship issues. So these are all really important in the actual ability to have an orgasm. I would say that that's from the research itself, but these are also important in the ability to enjoy intercourse as well. And 24% of females report dysfunction in orgasm. So cognitive behavioral therapy has been a well-known approach for people who have anorgasmia. So that can help with improving their ability to get an orgasm. And then there are behavioral exercises such as direct masturbation, sensate-focused, systematic desensitization, and sex education, communication skill training, and Kegels. And I'm going to hone in on that Kegel part later, because this is actually, I disagree with this, but I just pulled some of this from the research. And it's important just to know that these are all important factors in the ability to get an orgasm and to practice the ability to have that orgasm. But some of these aren't necessarily, you might not just be ready to jump in and do all these things. It might take time. You might not be able to just be able to masturbate. Maybe that feels too weird for you. And so you have to spend time doing what's called desensitization. Oops, I went forward and I don't know how to go back. Ooh, there we go. And then same thing with Kegels. We'll talk about this, like I said, in just a few slides, but Kegels aren't for everybody. And if your pelvic floor is already stuck in a really tight position, then that could be one of the reasons that you're not able to orgasm, because you're not able to continually get the contraction needed to reach orgasm, because your body actually already lives in this contracted state. Okay. Okay, here we go. Common issues experiencing around intimacy. So there can be a lot of things. People can have fear of intimacy. There can be difficulty with sex. There can be painful sex, painful penetration, painful deep thrusting intercourse, painful orgasm, or sometimes it's you get pain for hours after you have an orgasm, or cramping for hours after you have an orgasm. You can also have, like I talked about earlier, the inability to orgasm. And then you can also, these aren't necessarily related to, we're talking about difficulty with intercourse or intimacy, but some of the factors that can play into this, if you have trouble holding pee or holding poop, so you have urinary leakage or fecal leakage and or constipation, they can play into the health of the pelvic floor, which can then also affect the ability to enjoy intercourse or ability to enjoy orgasm. All right. So the root cause of a lot of these lay within the pelvis, like we talked about earlier. So I'm going to show you some anatomy pictures in just a second. And then I'm going to use this pelvic floor so I can show you really what the anatomy that's important to know when you start thinking about improving intimacy, thinking about improving your relationship or difficulties. with intercourse. Here we go. Okay, this is a lot of pictures here, but why don't you start by looking at my screen if you can see just me here in the picture. Hopefully you guys can see that. Devin, can you give me a thumbs up if you can see that? Okay, cool. Okay, so here is a picture of a vulva. This is all considered vulva. This is the entire thing is considered the perineum, and that includes anus, vagina, perineal body, and we have labia here, clitoris, and urethra. So urethra is where we have urination, clitoris is where we have orgasm, and then vagina is where we deliver babies or have penetrative intercourse, and then anus as well. And so these are just important structures. Let's see, to just talk about when we're talking about pelvic dysfunction, and I'll talk about healing some of this in just a minute. This is, if you look in the top left corner here, hopefully you can see my cursor, you'll see what it looks like when you look from the top down. Just some anatomy there. I'm going to come back to the rest of these pictures in a minute. So that was the pelvic floor here. So when we start talking about painful intercourse or painful orgasm or inability to orgasm, oftentimes what we're talking about is difficult, some kind of issue within the pelvic floor. This can be nerve related. There's a lot of nerves here, or it can be soft tissue related, which means it could be the muscles or it can be the ligaments that are affected. And when we have issues there, these issues can stem from many things. So I told you what the issues could be: painful with intercourse or even painful orgasm. But some of the problems can stem from adhesions in the muscles. So where you get tightness in certain muscles, or if you've had any pelvic infections ever, sometimes adhesions will lay down in response to a pelvic infection, and that can cause pain within the muscle itself or dysfunction within the muscle itself. You can have just general tightness. So many people born female, many women walk around with very, very tight pelvic floors and have a higher stress in life and environment. And that can make things, when you walk around with tightness like that, that can become just your normal pattern. So if you think about like making a fist, and you never let your fist go, eventually your hand gets stuck in this position and your hand isn't really that usable. Like you can't grab things or pick things up because you can't fully open your hand. This is the exact same thing that happens with the pelvic floor. So this is the exact same thing that happens with vagina, with clitoris, with anus. And when that happens, that can really contribute to painful intercourse or painful orgasm or inability to orgasm. This like pattern of tightness can cause hemorrhoids, constipation, because things just can't get out. So you might find yourself straining more and things like that. Any questions regarding pelvic floor dysfunction and how that kind of relates to painful intercourse or painful sex? Feel free to drop it in the chat. Any questions you have, you can be anonymous if you want to. And I'll try and make sure I keep my eye on that. Great. Okay, so how do you start healing your core and your pelvic floor to enhance your sex life? The most important things is to be able to unclench the pelvic floor. So if we're talking about the fist here, we're talking about relaxing that fist, opening the fist. Because when we open the fist, all of a sudden then we're able to stretch past the fist. So if my fist is the pelvic floor, like we're talking about here, it's really important that it has full range of motion. So with the pelvic floor, it's important to get with that full range of motion. Sorry, I'm checking the chat here. With the pelvic floor, it's important to get the full range of motion so you can experience the benefits of orgasm, so sex can be comfortable and all that good stuff. In order to get full range of motion, of course, a really important part is physical therapy. So having someone, what we do here is we're pelvic expert physical therapists, and we would kind of see what's happening in the tissue, identify the tightness, adhesions, or scar tissue that are creating that tight pattern, and then work with the muscles to help them open up. The way that you can start this at home, I highly recommend coming for an evaluation or seeking out pelvic expert physical therapy care. But the way to start this at home is through breath work. So inhaling into belly is where we're going to start with this. So I'm going to see if you can see me here. You are going to see me put my hands on my pregnant belly here. And you can do, I encourage you to do the same at home. So hands on belly. You can do this laying down. You can do this seated, whatever feels right for you. You're going to take a deep breath into belly. You want your diaphragm to push down into the belly and pull the air into belly. When you do this, you want your chest to rise a little bit, or not really at all. So the goal is for your hand to rise on your belly, but not for your hand to rise on your chest. So you're inhaling. My hand on my chest should not move, but the hand on my belly should move. Okay. And so when that happens, what happens when the diaphragm goes down into the belly is that the pelvic floor follows the diaphragm and relaxes and goes down. That's why this really deep breath work is really, really important. I'm going to go back a few slides. Oops. Actually, it's right here. This is perfect. So here's your abdominal wall muscle. And on the very top, you see that diaphragm. And on the bottom, you see the pelvic floor. When you inhale, this diaphragm drops into the belly and the pelvic floor follows and drops to the floor. So this should be, this is what should be happening when you do that type of breathing. And so this is like an anti-Kegel, okay? So this is the reverse of a Kegel. We're trying to open everything up and we want to try and improve our resting relaxation length. So we're able to open more with that breath. So many times when we start working with patients and say they are having intercourse, but it is uncomfortable, but they don't want to stop having it, they will often, we have them do this type of breath pattern during the penetrative exercise or during penetration with their partner. And so when penetration first occurs, to really open up and do that type of breathing, and that will help decrease the pain. A lot of times what happens during intercourse is that we brace for the penetration, we brace for the discomfort that can happen or that we're maybe expecting. And so our body's in this clenched position, and that's going to make things worse. And so the idea is that you would relax and open for it. A lot of times what I hear people say is, well, it feels like my partner's hitting something, and that feeling is scary to me. It feels like it's my cervix. And so I'm going to, that's why I squeeze around it. And most of the time, it's actually what we find is we can provoke that exact same pain of hitting something, but it's actually just when the third layer of muscles, so there's 3 different layers. When the third layer of muscles is really tight, that can feel like someone's hitting something. And so to help open up and loosen that third layer, we talk about doing this type of breathing. Does that make sense? If you have questions, please drop it into the chat. I'm happy to answer more. Oh, I didn't realize that the tightness of the pelvic floor is what causes constipation. It can be a definite cause of constipation, not necessarily the only cause, but that can definitely cause constipation. If your pelvic floor is not able to open and relax to get the stool out, then you start to develop a holding pattern. That holding pattern of the tightness, not letting the stool come through the anus, can cause the rectum and the sigmoid colon, which comes down and is what has to get the stool out. It can cause that to get more impacted. And so you lose, when that happens, the rectum can just get fuller and fuller and fuller, and you lose your natural sensation of what tells you when you have to have a bowel movement. So does that make sense? Hopefully that makes sense. So it's really important that you have healthy bowel movements every day, and pelvic floor tightness can really affect that. Cool. Okay. So I've mentioned it briefly before, but to Kegel or not to Kegel? That is the question. So most of the time we start our clients on the anti-Kegel diet. And the reason it's so important to do this, the importance of dealing with scar tissue, micro tears and tightness. The reason we start with an anti-Kegel diet is so we can work on the scar tissue, micro tears and tightness. So those tightnesses or the tears, the scar tissue, the adhesions that cause the tightness, if you walk around with tightness or stress causes tightness too, anxiety causes tightness. So if you walk around in those tightened positions, then it is absolutely pointless to do Kegels, because then you're just like trying to squeeze what's already squeezed. And so the range of motion just isn't there. The reason that people with really tight pelvic floors often have trouble getting an orgasm, and I believe this stat is higher than that study I showed in the beginning of 24% of people born female have problems with orgasm. I think it's much higher than that. And I think the reason being is because so many females have such tight pelvic floors that they cannot relax. And really, to get that an orgasm, you have to be able to have multiple contractions within the range of motion. So there, that is just a side note here. So most of the time we start on the anti-Kegel diet. We start with the breathing, and we start with stretching the tissue and working out scar tissue and adhesions. Again, this allows the muscles to work in their full range of motion, and it helps everything to be more functional. So this is really good for any birth prep. This is good for fertility. This is absolutely essential to have through menopause and before menopause, because once you hit menopause and your estrogen and progesterone levels decrease, you naturally lose some lubrication, and a lot of times you lose your range of motion of your pelvic floor. So if you can, this is why everyone should have pelvic floor therapy, is because if you can get this range of motion before menopause, you're like the likelihood that you'll be able to control your bladder through the rest of your life is so much greater than if you don't have this at all. And then you go through menopause and things tend to get tighter and have even less mobility. So how to have a healthy bowel movement to protect your core and pelvic floor. Again, I'm just going to start here. Oh, I'm going to stop here and I'll just check the chat. Why is it that so many books and websites encourage Kegling, especially birth prep? It seems so counterintuitive. Is Kegling more important after birth to tighten things up? Oh, that's such a good question. So the Kegels, I don't know. I mean, this is like my life mission, is to break that pattern of like thinking that Kegels are good. Kegels can be good when Kegels are done in a fashion of full range of motion. But I think in the last 5 to 10 years, we've really seen the research start to change that not doing Kegels is actually the more beneficial for pain. It's beneficial for orgasm. It's painful. It's beneficial for birth prep. However, I think the reason that the focus has still been on Kegels is because people who don't have any connection at all, but can maybe feel like Kegel, like at least they get some connection to their pelvic floor, even though it's not the connection you want them to have. It's really just, it's too bad. Where Kegels are super important is when you have full range of motion. So when you're able to fully relax and then Kegel, that is a great time to have, that is a great time to Kegel. Like when you can get into the full relaxed state. So if the hand is the pelvic floor and you can contract and then relax, that's when someone could be doing a Kegel. We honestly don't teach Kegels as an exercise really ever. If someone's deadlifting or picking up a baby carrier or a car seat or a baby, we teach them to Kegel and activate their core. So it's a whole core system that's activating. And so we do teach that postpartum and actually during pregnancy, but only through functional movements, not through repeated contractions. It's almost as silly as having someone just do bicep curls and maybe not even through the full range of motion, because it's not functional unless it's used in a functional pattern. I hope that answers your question. The only time after birth that it is okay is like within the first few days after birth, you'll want to do a couple Kegels just to like when you initially get out of bed or when you initially like roll to your side and get out of bed. And like one of the main things we teach is exhaling with that movement for a lot of our clients. And just that exhale alone and activation of their lower abdominal muscles is going to help them get Kegel activation, get pelvic floor activation. But then it's not an isolated contraction just for the pelvic floor. So hopefully that makes sense there. How to have a healthy bowel movement to protect the pelvic floor. So again, the reason we're talking about this in intimacy on the same exact presentation is because if you can get this kind of movement inside the pelvic floor, which is healthy and good, then you're on your way to having better sex. You're on your way to having better control of your pelvic floor. You're on your way to having better orgasms. So Having a healthy bowel movement and being able not to strain when you have a bowel movement is really important in sexual function, because these are all so close together, all these holes, right? So it's important that they all work together, because that's what happens. So hands on belly again. So to have a healthy bowel movement, the positions that we like to do are, let's see if I can get in this position. So is legs spread apart and you're leaning forward. A squatty potty is also going to help get you in the same exact position. What it does here is it straightens out the chute. So if this is your anal rectal angle, it's going to help straighten the chute so the poop can get out a lot easier. And so that's why you want to bend forward or have a squatty potty. So have your legs elevated so your knees are above your hips. Once you're in that position, you'll take 3 nice diaphragmatic breaths. So inhaling, diaphragm goes down into belly. This is going to help pelvic floor relax. It also helps stimulate peristalsis. So it's going to move the stool along. So this is my right side, that's my left side. It'll move the stool along to be able to come out. So we're using our breath to stimulate the bowel movement and to relax the pelvic floor. So we'll do 3 breaths. And on the 3rd breath, you'll gently bear down like you're trying to fart, but you don't want anyone to see you. This is the part of the relaxation that goes from here to here, like just overextension just a little bit. So if you were here, now you're going to go here. So you should feel like it's just like the slightest movement of bearing down, and it's not straining at all. So questions on having a healthy and happy bowel movement? And if anyone's like, why are you teaching this to us on a webinar that's about intimacy? I can say that again, but cool. Okay. So another thing, so I'm not teaching directly Kegels because I don't really ever believe in teaching that unless it's for a functional movement. But one thing that I do think is important is the ability to find your transverse abdominis muscle. This is one of your deep core muscles, and it's this long abdominal wall muscle that you see on the slide right here. That is your transverse abdominis muscle. When you activate that, you're going to naturally get a little lift of the bladder, and you might get some movement of the clitoris as well, and the pelvic floor itself. Okay, so finding your transverse abdominis. So one way you can find this muscle, and now if you constantly walk around with your abs pulled in and sucked tight, you shouldn't really start with this. You should start with the breathing and really focus on the breathing so you can get range of motion. When you start activating this muscle, you will put your hands on the inside of your 2 hip bones. So if your hip bones are here, you'll put your hands here and you'll gently pull up and in. You can imagine if you had a wire and I was putting a wire from this hip bone to this hip bone right here, and I just pulled it tight, you would feel like you're gently lifting your lower abdominals, or you're pulling up your belly button just gently. And that is contraction of your transverse abdominis. A simple thing that can happen is just do this 10 times, repetitions, and hold for 10 seconds. But when you do, make sure between the repetitions that you relax and take a nice deep breath into belly so you know you're relaxing everything. This is like the very foundational basics of how to start really developing a healthy core. So in the healthy core, it's going to be important for intimacy, it's important for intercourse, it's important for orgasm. Just to touch on a few things. So one of the things that we also look at as pelvic expert physical therapists is where your pelvic floor is most relaxed. So is that on your back with your knees up? Is that in an all fours position? Is that on your side? Is that maybe seated, or if you're on top of your partner? So we look at different places in which the pelvic floor is most relaxed, where you have the most ability to control that relaxation and maybe a contraction too. So one thing we can do here is determine what positions might be best for you, or give you different positions that might actually work for your body if certain positions didn't work for your body. But we also believe that we want every position that you want to have work for your body. And so we'll find maybe why something's not working. Maybe it's a tight ligament back sorry, maybe it's a tight ligament back here. Maybe it's a tight muscle deep in here, or maybe it's just your hip motion doesn't work. Or your hip motion is a little limited on one side and it's causing spasm of this muscle. So it's feeling like your partner's hitting something, or it's feeling like your partner can't get in all the way in certain positions. That can all be due to pelvic floor. And so we take a look at all of that and really evaluate like some good starting positions for you to have, and then where you can progress to. Are there go-to positions that are considered better or more likely to have that flexibility for everyone, or is it much more unique to each person? Good question. It's very unique to each person. I would say a lot of times people have, it's not even fair to say, because like if someone has back pain or hip pain, that can affect which position feels good for them, and it can affect how tight their pelvic floor is if they're in pain and in one position or another. But like, so that is for intercourse. One thing that's definitely true though is that like on your back with your legs up, pelvic floor is not typically relaxed in that position. And that's the same position that we tend to push babies out in, at least in the hospital. And so we really try to talk about different positions that are more advantageous to you and your body. I would say oftentimes in a side lying position, a lot of people have a better time relaxing. But it's really independent and unique to each person. Good question. Thank you. Okay. So restore your pelvic floor now before you have to suffer with dissatisfying or painful sex and chronic pain, and avoiding surgeries and medications. And like I said in the very beginning of the slideshow, for females or people born female, the pharmacological agents that are available for improving intercourse or improving orgasm are just not there for women or for people born female. So that's not really a great option at all. And really getting this muscle in the best shape possible is the best option for improving that sex life. It's also extremely important because it's not just going to improve the sex life. It's really going to improve the quality of your entire life because it's helping you, excuse me, let me take a sip here. It's helping you absorb the forces that come through your body even when you're just walking. The pelvic floor has to be this dynamic organ that every time your foot hits the ground, the core, the pelvic floor being essential in this, has to move to absorb the force. If your pelvic floor is really tight and taut and not mobile, then the joints end up taking up a lot more of the forces. So this is really important in order to get mobile. It's honestly never too late, but what we end up seeing is that people in their 70s, 80s, and beyond have so many other things that they accept, like peeing their pants or diapers or pads as just part of their daily life. And, it just becomes less of an issue. And it's almost like it's commonly accepted in our society just for everyone to be peeing their pants as they age. And that's definitely a problem. So, getting the most range of motion, getting your pelvic floor in shape sooner than later is going to help not just improve sex life and orgasm, but it's going to improve your whole life. Okay, cool. So of course we offer the 30-minute discovery visits if you're interested in signing up with us, or even just if you're not and you want to just talk to a doctor about what you're experiencing and see if pelvic floor PT could be right for you. And thank you for attending. All right, guys. Any specific questions? Cool. Devin dropped a note for a free discovery visit if anybody's interested. You can follow us on bodymotionpt.com or at bodymotionpt on Instagram or Facebook or Pinterest. Thank you so much for joining me today, guys. Awesome. Have a lovely sunny evening.